following the World Health Organization's (WHO) declaration of Mpox, formerly known as monkeypox, as a global health emergency. Countries have begun implementing various health measures at airports and seaports to control the spread of the new, more dangerous variant. On Wednesday, the WHO declared Mpox a global health emergency after an outbreak in the Democratic Republic of Congo, DRC, spread to 26 countries. This marks the second such declaration in 2 years, with the first occurring in May 2022 when the virus reached over 70 countries, largely spread through sexual contact. The recently identified variant, Clade 1b, is proving to be more deadly and transmissible than the Clade 2b variant discovered in 2022. Africa remains the most affected continent, with 2,863 confirmed cases and 517 deaths, while the DRC has reported 16,789 cases and 511 deaths, the highest numbers globally, according to the Africa Centers for Disease Control and Prevention, Africa CDC. While many European countries have not yet implemented travel restrictions, the European Centre for Disease Prevention and Control, ECDC, has recommended vaccinations and urged countries to take steps to control the Mpox Clade 1b variant, which has impacted countries like the DRC, Burundi, Rwanda, Uganda, and Kenya. The United States announced plans to continue working closely with African governments, Africa CDC, and WHO to manage the outbreak. They are also advising citizens to get vaccinated, though no cases have been reported in the U.S. In Asia, countries like China, Thailand, and Malaysia have introduced stringent travel measures similar to those seen during the COVID-19 pandemic. China, in particular, has enacted strict border controls for individuals displaying symptoms or those who have traveled to Mpox-affected regions. Travelers at Chinese airports will be subject to screening and, if necessary, isolation for testing and treatment. African countries are also stepping up precautions. South Africa plans to screen travelers at airports, while Kenya has begun testing incoming travelers, reporting mostly mild cases so far. Nigeria has mandated that all travelers fill out a declaration form, either at the airport or online, if they have traveled to certain parts of Africa. The WHO has identified East African countries such as the DRC, Burundi, Kenya, Uganda, and Rwanda as areas where Mpox is particularly prevalent. Vaccines like MVABN, LC16, and ACOM 2000 have been recommended for protection against the virus, with 2 doses needed for full immunity.